Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right. Welcome to Think Big with Dan and Qasim. And our guest today is Mary Blake. So Mary, if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Well, hi, Dan and Qasim. I hope you guys are having a wonderful Wednesday today. Thank you for having me on, first and foremost. So to answer your question, I'm from Dallas, Texas, born and raised. I still live in Dallas, but I've lived abroad for a few years. And have gotten to see some really interesting things and travel. And I travel as part of my daily career. So I'm still glad that, I get to travel and see a lot of things.
It's like, what do you do for a living?
Yes, that is important. By career, I'm what's called a clinical research associate. And what that is a type of medical auditor. So we travel to hospitals or medical schools that are conducting research studies or clinical trials, and we edit and audit them to make sure that they're in compliance with local and federal regulations. So basically, you don't have any medical facilities that are being reported for malpractice or patients that have been complaining of symptoms and adverse effects from taking different drugs that haven't gone unreported.
Awesome. So how did you get started in your career?
So initially I was pre-med, and as I was kind of finishing up my preliminary medical studies in college, part of that you have to do shadowing, and you have to actually go to a hospital, work underneath doctors, shadow them, work with patients one-on-one. And when I started that, to be honest, I hated it. I didn't like it at all. And I was so far progressed along. So I was kind of like, well, where do I go from here if that's not the exact route I want to take? So I ended up going towards like the Masters of Public Health. And the ultimate goal is to go into kind of the politics and ethics of public health policy. So currently seeking my doctoral of public health, and the goal initially is to run for public office. And that way we can represent people who are in the community who may not have a voice about their public health questions, or, maybe living in areas where they may not have access to healthcare, or they may not be able to afford medications or devices or whatever they need for the quality of life. So to be an advocate for those types of people is something where I definitely see myself progressing on into the future. And I also have my startup company that I do that may have been one of the ones you saw. And that's been like my heart project, because initially it's so interesting when you're working in the field and you start noticing trends. Number one, that was part of my job anyway, to recognize trends, notice them, report them. But when you kind of see them across the board in different cities and different countries around the nation, then instead of just reporting it, one day I thought, why don't I create something or come up with a process to make this more efficient? So specifically, one issue that a lot of our clinics have is the ability to locate viable patients for some of these studies. And that it just comes down to they don't have time to, go out and look for people, go to patient advocacy groups. They don't have the know-how. So that includes marketing, that includes, locating people where they are. And a lot don't always have that bedside manner, talking to people and really convincing them to try something new that they may be apprehensive about, or may not have a lot of information about, may not want to do. So I thought that it would be cool to come up with a concept to kind of innovate and make that process more effective. And so now we have Panda Health, which is a healthcare platform, and we specialize in patient recruitment and acquisition and web development services for healthcare facilities.
Oh, it was good. It was good. So, what was your biggest challenge when starting this startup that you just mentioned?
So I would say we currently have two challenges that we are working around. And for anyone, looking to go into the startup space or entrepreneurial ventures in general, I would number one say come up with a solid plan, come up with your strategic steps, and that's going to include financing of your venture, your company, or your startup, or your partnership. Look into what types of financing and what types of financial projections it's going to look like, and whatever that is, double it, because it's not enough. So one of the initial challenges was that our earliest and initial projections of what we thought we would need, like I said, would end up not being enough. Luckily, though, I've got a good team of individuals that I work with, and we communicate on a daily basis, multiple times a day. We talk about everything. We really try and work through everything together, where some people have weaknesses, other people have got strengths, which I really love. And it's a, very open, non-judgment free zone. Other challenge that I would say that we were overcoming would just be helping people find who you are and where you are. An online presence is everything. It's very important, but also you have that physical presence that we have. So it's not just a digital service. We're bringing a physical person and connecting them with a site, connecting them with a actual facility. So there's kind of those two different aspects of it, right? You want to locate them via digital means, and then you want to bring them to a physical place. So, there's some logistics planning in there. And then there's, making sure that they're comfortable, making sure that they have the information that they need, making sure that they qualify, making sure that they're compensated adequately, and making sure that you are on good terms and communicating with your physician, staff, and team. So those have been some of the barriers and challenges that we've worked through. Luckily, most of them we are right on track to meet those expectations. So I'm happy about that.
That's great. You said you are providing some solutions to the healthcare sector. So I would like to ask, what is the role of technology in your business? Like how it is working over there? What are the good sides of technology? And
Yeah, so like I stated earlier, it's, a healthcare agency. We use technology to help back it. And essentially, the role of technology for us is when we are acquiring those patients and looking for them, we have a portal set up, and it's a system of funnels, and it uses a combination of social media, websites, EMR, which is electronic medical records, and other physician records to pinpoint those individuals. It reaches out to them digitally, which lets them fill out a form where they can put their information in. And then it also sends them text, it sends them messages over social media, and that way we're able to track them and connect them with the facility.
great. And you are using AI in any and at any stage in the whole process or not?
We do. So we have a separate project, and it's a travel-based planning company. And that one we use a combination of ChatGPT and I believe it's called Monica. And so what that does is it actually, when you're getting ready to travel or go on some type of trip, it sends you real-time updates to the place that you are going, to place you're traveling. It sends updates about things to do in that region. So say if you're going to France and you're curious about, I'm taking my family, going to do, I've never been. So we have a mobile app and it's available for download on both Google and Apple stores. And so after downloading that, you're able to see there's a budgeting tool. So you can put in USD and it will convert into French currency. We have a tips and tricks, so best packing and planning procedures. And then once you get there, we actually have a lifetime in-person chat feature. So you can speak to locals and they can actually give you suggestions about what to do, where to go, places to eat, places to shop while you're in your trip. And that way you have a much more holistic trip, and you can upload photos to the app as well. So that's how we use AI. We do have a couple other future ideas for it, such as VR, but you'll have to stay tuned to get all of the inside information.
That's exciting. So I guess, you do all these different things. You're running multiple companies, you're doing all these things. How are you able to structure and manage your time and be successful in the same manner?
That is a fantastic question, Dan. And let me tell you, it's an ongoing challenge. It's an ongoing work-life balance. There are some days, so I'm not going to lie, there's some days where they're like 16, 18-hour days. And you may spend 8 hours of your day focusing on one aspect or focusing on one thing or focusing on one company. And then you take a break, have a snack, a nap, and you pivot and you're spending another 6 or 8 hours, working on another one. But I'm a big advocate of being able to kind of find ways to take moments out for yourself. So I'm a big health nut and gym rat. So I'll take an hour or so, I'll go work out, I'll come back, I'll have a snack, and it kind of gives my mind a break so I can work out my body physically and then come back and then get back to it if you need. But yes, I would tell anybody, if you have a planner or if you set timers for yourself, that's another thing that I use. I'll have a sticky note and I check something off and I say, I'm working on this 3 hours and then I'm gonna go walk around. I'm going to do something different. So, have those things set in for you. I would also say have a person that's going to check up on you. I have a lot of days where you just feel overwhelmed because you're sometimes you're like, where do I start? Or something you thought was going to be quick and it ends up going way over. So you're like, I'm still not done with this and I need to start on something else. But, definitely have, whether it's a mentor, whether it's a partner, whether it's, a friend, to kind of check up on you, bring you down when you have those moments where you're full of anxiety, to just remind you of the bigger picture. So that's what I would say. And then I would also say sometimes, the mindset is most important. Like sometimes you just have to do it, like just power through, just do it, because the sooner you do it, the sooner it's done. And once it's done, you don't have to worry about it anymore. You don't have to stress about it anymore. So sometimes there's not an answer other than just to just power through it and go. And once it's done, it's done. So I hope that helps. I hope that answers your question.
Yeah, definitely. That's awesome. So what would you say in terms of for your businesses are the top priorities in the next 3 to 6 months?
I was just talking to my partner about this today. 3 to 6 months, we're looking to drastically increase our incoming revenue, cash flow, obviously. One thing we're really looking to do other than that is to really, for the Panda Health, is to really become almost like a household name in that niche. So it's a niche market in that not every clinic does research or trials, or not every hospital does it. On the good end, once you kind of get into those sites, there is a lot of referrals that go on. Those physicians talk to each other all the time. So our biggest goal for that one is just for them to start talking to us all the time. So we're really working on those different touch points, whether it's email marketing. We're going to actually have some assistants go out to clinics in public and just give them a face and give them some things they can read, following up, calling them. So the goal is to become one of the top provided and top recommended sources for patient recruitment and web development services for Panda Health. And for PathoSpy, which is a travel planning project, we are in talks to partner with one of the military bases out in Dallas. So I won't say which, but solidify that contract, and then also furthering contracts with other companies that have staff or business professionals that travel frequently that could take advantage of those services.
Okay, that's cool. So in terms of technology, what is one thing specifically that when it comes to your business that you wish you had, a tool or feature that you wish you had that could help you improve in your business today?
I wish I had how people use Siri or Alexa, and it's just like, Siri, what is this? Or tell me about this, or remind me. I wish I had a tool that I could say, look up all of the physicians that do clinical trials within a 50-mile radius, provide all of their contact information, provide what specific trials they do. And, I wish I had a tool that I could just ask it and it would provide it. There are some that when you type in the algorithm, it populates them. And we do have a couple that we work with that are pretty good. But obviously, the more hands-off you can be, the better. If there was something even, more automated that it would just populate itself for me, or for anybody, I think that's helpful. But a lot of the tools they have today are great. We do use ChatGPT. We use, I think it's OpenAI and Monica. So they actually are very helpful. And I would encourage anyone to kind of play around with them when they get a chance.
Awesome. So if we were going to have this conversation again in 1 year from now, where do you expect things to be for you and your businesses?
1 year from now, I would expect us to open up a brick and mortar. So have actual physical offices around the Dallas Metroplex. We'd also like to maybe open up a couple offices in other localized cities. So maybe, one in LA, one in New York, one in Atlanta, and really grow this idea of how we're approaching the patient recruitment and acquisition, because it's a lot different from our competitors, and in my opinion, a lot more effective, a lot better. But I see ourselves growing. I would at least like to see us open up our first office here in Dallas. And I invite you both to come and check it out and visit with us. And then for our travel project, like I said, really getting that off the ground. I would really love to connect and contract with other large-scale companies or medium that have a travel-based employee set up, and get something where they don't have to go out of their way where they're packing and when they're planning. So to really step in and be that answer for them and be that resource for them. That's my goal. So.
That's really cool. So, yeah, for sure. We're rooting for you, and definitely I appreciate the invite. I definitely would be honored as soon as you have that physical location to come and check it out. So, in terms of, advice, like what is the one biggest piece of advice that you would give to your younger self before you started this entrepreneurship journey?
Start sooner. I would have told myself to not be so afraid of failing, not be so afraid of not having all the finance options, answers in place, not be so apprehensive about what people are going to say or how people are going to react or their opinions, because people are very opinionated in things that they don't understand. If it's not their vision, then they can't see it. And sometimes if they can't see it, it doesn't make sense. I never would have thought 6 or 7 years ago that there would be a business where other people would get into your car and you would take them places. I would never have seen that. I never would have guessed Uber would be a business. I never would have thought really there would be a business where you can just pay someone to do all your grocery shopping for you and just drop it off. And so, I say all that to say there's business opportunities everywhere. Now I see it all the time. I mean, it's almost like a sixth sense. I'll walk into somewhere and I'll see something. I'll be like, what they should do? Instead of doing that, they should do this. Oh, instead of doing that, they should get rid of that, replace it with those. I could definitely open up another one and take all of their customers or help them out with their customers. So I would tell my younger self to, number one, not be afraid of stepping out there and just and coming up with a plan and starting. And I would tell myself to start saving, like I was speaking earlier, whatever, financial projections are, project more. I would tell myself to get with a good mentor, get with a good group. I have one now, but I wish I had one earlier. Yeah. They are able to tell you so many like hacks and shortcuts and things that took me a long time or took me a while to figure out. And then when I got my mentor, they're like, oh, all you have to do is this and this. And I'm like, that would have been so helpful, a month ago. But and then I would just tell myself to keep the mindset of not living in one box, not looking at life, within boundaries or within any type of confinement, and to see that there really is opportunity where you make it. When people tell you no, when they shut the doors in your face, sometimes you have to create your own path and you have to create your own door. And I think it's exciting. It's scary, but that's something that it's been the best decision that I've made thus far.
Awesome. So if somebody wanted to reach out to you or your business, can you share the best way for them to reach out to you and your business's website or social media?
Absolutely, yes. So I would love to connect with you or anybody. If they are interested, please have them reach out to me via email, and that's blakeinc365@gmail.com. They're also welcome to reach out to us on LinkedIn, which is Panda Health. And I will provide the link for you following our call. Or they can reach out to me over Instagram if they have, social media, and I'll provide that information for you too.
Well, Mary, thank you so much for your time. I really enjoyed our conversation. We're rooting for you and wishing you the best of luck.
Thank you so much. I appreciate it. And like I said, the best is yet to come. So stay tuned.
Yeah. Sounds great. Sounds great. Thank you so much.
Thanks. Have a good day.
All right. Bye.
You too.
Bye.
Thank you, guys.
Bye.
Bye.